Hello, welcome to ANA community. In this particular video, we are going to discuss the context of Rogamarga. What actually Rogamarga is, what are the possible diseases that can be afflicted in different Rogamarga as such, and how to interpret as such. What are the things we need to know while discussing about the Rogamarga and how this can be learned as per the present understanding we are going to learn. Rogamarga is one of the very important concept of Roga Nidana, or what we can say Ayurveda diagnostics. This is actually comprising of two different Sanskrit words, Roga and Marga. The term Roga, so that means Rogastu Dosha Vaishamyam. So that means any kind of the imbalance observed in the dosha or bioenergy, maybe in the form of the Vata bioenergy or Pitta or Kapha bioenergy. So that will be responsible for the manifestation of Roga. That means any kind of the discomfort observed. Marga means, so there are the different ways where these particular vitiated dosha or bioenergy that will be moving in the different parts of the body. Depending upon the nature of Nidana Sevana, etc., we are going to identify exactly which particular areas these particular vitiated dosha are moving. For example, if the person is having the entry of the pathogen, or what we can say the Nidana, that is happening through the mouth, definitely the clinical manifestations are observed initially in the mouth, then in the esophagus, then in the stomach, then small intestine, large intestine. In that way, there will be the possible movement of the pathogens that are going to take place. And based on that, the person will be having the abnormal functioning of the dosha in these particular organs or in this particular avayava. So, based on the uh, context of the Ayurveda aspect, three Roga Marga are being explained. Shakha, Varmasti Sandhi, and Koshta. So, Trayo Roga Marga iti Shakha, Varmasti Sandhaya, Koshtascha. So, Shakha refers to they are the branches. So, here what we can say the extremities or the skin, etc., or muscles, etc. Marma asti sandhaya. So that means the vital points, marma or asti, that means the bones, and sandhi, that is the joints. Koshtha, that is referring to the whole Mahasrotas, or what we can say the alimentary canal. Further, it is being mentioned Tatra Shakha Raktadayo Dhatavaha Tvakcha Sabahyo Rogamarga. The Shakha Rogamarga that is also being termed as Bahya Rogamarga, which includes Raktadi Shadhatavaha as well as Tvak. Raktadi Shadhatavaha in the sense Rakta, Mamsa, Meda, Asthi, Majja, and Shukra. Tvak in the sense that is the skin as such. Why Rasadhatu is not being mentioned? Because the assessment of the Rasadhatu will be done on the examination of the Tvak itself. That is the reason the Tvak is being specified, not the Rasadhatu. Further, Marmani, that is Punaha Basti Hridaya Murdhadini, that are the vital points or vital parts. So, which are being mentioned in the textbook. So, Asti Sandhayo, so that means the bones as well as the joints in between those bones, plus Snayu Kandaraha, which are being associated with these ligaments and tendons, which are being connecting with these bones and joints. They are being categorized under Madhyamo Rogamarga. So, Marmani Punaha Basti Hridaya Murdhadini Asti Sandayo Asti Sanyogaha Tatra Upanibaddhascha Snayukandara Samadhyamo Rogamarga. Koshtaha Punaruchyate Mahasrotah Shariramadhyam Mahanimnam Amapakvashayashcheti Paryaya Shabdaihi Tantre Sarogamarga Abhyantara. So, the Abhyantara Rogamarga, that is Mahasrotas, or what we can say the alimentary canal, which is also being termed as Sharira Madhya or Mahanimna or Ama Pakvashaya, etc. So that is being considered as Abhyantara Rogamarga. So whenever if you think about these different types of the Rogamarga, that will be having their own significance. So because the variations in the source of the entry of the pathogen in the body. Suppose if the person is having the entry of the pathogen that is to take place through the mouth, definitely the clinical manifestations are mainly concentrated upon the alimentary canal or mouth, etc. Suppose if the person is having the entry of the pathogen is going to take place through the urethra, definitely the lakshanas are specifically are being observed in the urethra or urinary bladder. If the source of the entry of the pathogen is happening through the eyes, initially the lakshanas will be observed around the eyes in the form of either tearing of the eyes or redness of the eye, etc. So like that, the source of the entry of the pathogen that is going to decide the what do you say, that the nature of the movement of these particular vitiated dosha that is going to happen because of this particular entry of the pathogen. Further, the nature of the movement of the pathogen in the body. So that is the nature of the pathogen, of the movement of this particular pathogen. For example, if the person is having the movement of the pathogen is going to take place through the oral cavity, naturally, so that will be taking place, the movement will be taking place from the mouth to the anus. So that is, in that particular situation, the movement of the pathogen is going to take place through the mouth, pharynx, esophagus, stomach, small intestine and large intestine, later through the anus, that is going to get eliminated. That is what we can say the manner of expulsion. So here the Rogamarga as such, that will be only in the alimentary canal. So here in this particular occasion the Rogamarga could be Abhyantara Rogamarga. So like that, the significance of the particular concept will be helpful in deciding the nature of the movement of the pathogen or the vitiated dosha in the body, we can able to decide. As far as Rogamarga Vikara, it is being mentioned that, so that is the Tatra Ganda Pidaka Allergy Apachi Charmakila Adhimamsa Mashaka Kushta Vyangadayo Vikara Bahirmargajascha Visarpa Shwayathu Gulma Vidradhi Adayah Shakhani Sarino Bhavanti Roga. So these are the Bahya Rogamarga Vikara. Galaganda, Pidaka, Allergy, Apachi, Charmakila, Adhimamsa, Mashaka, Kushta, Vyanga, etc. plus Bahirmargaja, Visarpa, Shwayathu, Gulma, Vidradhi, Arshas, etc. As far as Madhyama Rogamargaja Vikaras are concerned, Pakshavardha, Graha, Apatanaka, Ardita, Shosha, Rajayakshma, Asthi Sandhishula, that is Asthishula and Sandhishula, Budapramshadayah, Shiro Hrudaya Bastirogadayah, Cha, Madhyama Margani Sarino Bhavanti Roga. So, Pakshavadha, Apatanaka, Ardita, Shosha, Rajayakshma, Asthishula, Sandhishula, Budapramsha, Shiro Roga, Basti Roga, etc. They are considered to be Madhyama Rogamarga Vikara. Jvara, Atisara, Chardi, Alasaka, Visuchika, Kasa, Shwasa, Hikka, Anaha, Udaraplihadayo, Antarmargajaha, Cha, Visarpa, Shwayathu, Gulma, Varsho, Vidrathi Adayaha, Kushtani Sarino Roga Bhavanti. So that is Jvara, Atisara, Chardi, Alasaka, Visuchika, Kasa, Shwasa, Hikka, Anaha, Udara, Liha, etc. plus Antarmargaja, Visarpa, Shwayathu, Gulma, Arsho, Vidradhi, etc. They are being considered to be the Abhyantara Rogamargaja Vikara. We need to know about these different explanations in brief. Before going into that, we should know the following aspects. Dosha prakopa karana. So that is vyayamad, apatarpanat, prapatanat, bhangat, kshayat, jagarat, veganam cha vidharanat, atishuchah chaityad atitrasatah, rukshakshoభకశాతిక్త కటుకైరేభిః ప్రకోపం రజేత్ వాయుర్వారిధరాగ్మే పరిణతే చాన్య అపరాన్యే అపి చ. These are the vata prakopa karana. कटु अम्लोष्ण विदाहितिष्ण लवण क्रोधोपवास तप स्त्री संपर्क दिलातसी तदि सुराशुक्तार नालादिभिः भुक्ते जिर्यते भोजने च शरदि ग्रीष्मसिति प्राणिनां मध्याह्ने तथा अर्धरात्र समये पित्तं प्रकोपं व्रजयेत्. These are the pitta prakopa karana. गुरु मधुर रसात् स्निग्ध दुग्धेक्षुभक्ष द्रवदधि दिन निद्रा उपसर्पिष्प्रपूरैः तुहिन पतन काले श्लेष्मणः संप्रकोपः प्रभवति दिवसादौ उत्तमात्रे वसन्ते. These are the Kapha Prakopa Karana as mentioned in the Madhukosha commentary Madhava Nidana first chapter 5th shloka. The next you need to know about Dosha Vridhikshaya Lakshana. For example, Vata Vridhi Lakshana and Vatakshaya Lakshana. Vridhastu Kurutenila Karshakashnushna Kamitva Kampana Shakrit Grahan Balanidrendriya Brahmsha Pralapa Brahmadinata. Lingam Shine Nilengasya Sadolpam Bhashitaitam Samnyamohastata Shleshma Vrutyuktamaya Sambhava. Vata Vridhikshaya Lakshana. Pitta Vridhikshaya Lakshana. पीत विन्मूत्र नेत्रत्व क्षुद्रदाहल निद्रताः पित्तम पित्ते मंदोवनल शीतम प्रभाहानिः. As far as kapha vridhikshaya lakshana are concerned, श्लेष्माग्नि सतन प्रसेकालस्य गौरवं श्वैत्यशल्य स्तांगत्वं श्वासकासाति निद्रता कफे भ्रमः श्लेष्माशयानां शून्यत्वं हृद्रभः शतसन्दिता. अष्टांग हृदय सूत्रस्थान 11th chapter. धातु वृद्धिक्षय लक्षण. As far as dhatu vruddhi and kshaya lakshana are concerned, so rasopi shleshmavat raktam sarpaplih vidradhin kushtavatastra pittastra gulmopakasha kamala vyangagni nasha sammoha raktatvam netra mutrata mamsam gandar udagranti gandorudar vrdita kanthadishwadi mamsam cha tadvan metastashramam alpe picheshite shwasam sviktanoudar lambanam asti adjasti adidantamsham ajja netranga gauravam parvasu thula moolani kuryat krichranyarumshicha अतिस्त्री कामतां वृद्धं शुक्रं शुक्राश्मरीमपि रसे रौक्षं क्षमाशोष ग्लानि शब्दा सहिष्णुता रक्ते अम्ल शिशिर प्रीति शिराशैथिल्य रुक्षता मांसे अक्षग्लानि कंठस्विशुष्कता संधिवेदना मेधसि स्वपनं कट्य लेह्नो वृद्धिः कृशाङ्गता अस्न्यस्य सोदा सदनं दन्तकेशनकादिषु अस्तनां मज्जनि सौशिर्यं भ्रमस्तिमिरदर्शनं शुक्रे चिरात् सिच्चेत शुक्रं शोणितमिव वा दोदोत्यर्थं षणयोर्मेढ्रं धूमायति वच. अष्टांग हृदय सूत्रस्थान 11th chapter. As far as Malavriddhikshaya Lakshana are concerned, Mutram tu Bastinistodam Krite Apyakrita Samyatam Kukshavadhamanamaatopam Gauravam Vedanam Shakrit. Then Svedodisveda Durgandya Kandurevam Charakshaye Mutrelpam Mutrayet Krichai Vivaranam Sahasramevava पुरेशे वायुरंत्राणि सशब्दो वेष्टयन्निव कुक्षौ भ्रमति आत्युक्तो हृत्पार्श्वे पीडयन् वृषं स्वेदे रोमच्युति स्तब्ध रोमता स्फुटनं त्वचः. अष्टांग हृदय सूत्रस्थान 11th chapter. स्रोतो दृष्टिकारण क्षयात् सन्धारणाद् रौक्षात् व्यायामात् क्षुदितस्य च प्राणवाहिनी दुष्यन्ति स्रोतां सन्यश्च दारुणे औष्ण्याद् आमाद् भयात् पानाद् अतिशुष्कान्न सेवनात् अम्बुवाहिनी दुष्यन्ति तृष्णायाश्चाति पीडनात् अतिमात्रस्य चाकाले चाहितस्य च भोजनात् अन्नवाहिनी दुष्यन्ति वैगुण्यात् पावकस्य च गुरुशीतमतिस्निग्धम् अतिमात्रं समश्नताम् रसवाहिनी दुष्यन्ति चिन्त्यानां चातिचिन्तनात् विदाहीन्यन्नपानानि स्निग्धोष्णानि द्रवाणि च रक्तवाहिनी दुष्यन्ति भजतां चातपानरौ अभिष्यन्दीनि भोज्यानि स्थूलानि च गुरूणि च मांसवाहिनी दुष्यन्ति भुक्त्वा च स्वपतां दिवा अव्यायामा दिवा स्वप्नात् मेद्यानां चातिभक्षणात् मेधो वाहिनी दुष्यन्ति वारुण्याश्चातिसेवनात् व्यायामात् अतिसंक्षोभात् अस्तनामतिविखट्टनात् अस्थिवाहिनी दुष्यन्ति वातलानां च सेवनात् उत्पेषादत्यभिश्चन्दात् अभिघातात् प्रपीडनात् मज्जावाहिनी दुष्यन्ति विरुद्धानां च सेवनात् अकालयोनिगमात् निग्रहात् अतिमैथुनात् शुक्रवाहिनी दुष्यन्ति शस्त्रक्षाराग्निभिस्तथा मूत्रितोदकपक्षस्त्री सेवनात् मूत्रनिग्रहात् मूत्रवाहिनी दुष्यन्ति क्षीणस्याभिक्षतस्य च सन्धारणात् अत्यशनात् अजीर्णाध्यशनात् तथा वर्चोवाहिनी दुष्यन्ति दुर्बलाग्नेः कृशस्य च व्यायामात् अतिसंक्षोभात् अस्तनामति व्यायामात् अतिसन्तापा शीतोष्णक्रमसेवनात् स्वेदवाहिनी दुष्यन्ति क्रोधशोकभयैस्तथा Charaka Vimana, 5th chapter. As far as Srota Dushti Lakshana are concerned, Dushtanam tu Kalbesham idam Vishesha Vijnana Bhavati Tadyatha Ati Srishtam Adibadham Kupitam Alpalpam Abhikshnam Vasa Shabdashulam Utvasandam Drishtva Pranavahanyasya Srutamsi Pradushtani iti Vidya Pradushtanam tu Kalbesham idam Vishesha Vijnana Bhavati Tadyatha जिह्वातालोष्ट कंठक्लोम शुशं पिपासां चाति प्रवृद्धां दृष्ट्वा उदकवाहन्यस्य स्रोतांसि प्रदृष्टानीति विद्या प्रदृष्टानां तु खल्वेषाम् इदं विशेष विज्ञानं भवति तद्यथा अनन्नाभिलषणम् अरोचक अविपाको छद्यं च दृष्ट्वा अन्नवाहन्यस्य स्रोतांसि प्रदृष्टानीति विद्या अश्रद्धा च आर्जिष्यस्य वैरस्य मरसज्ञता प्रल्लासो गौरवं तन्द्रा साङ्गमर्दो ज्वरस्तमः पाण्डुत्वं स्रोतसाम्रोधः क्लैव्यं साधः कृशाङ्गता नाशोग्नि रयथा कालं वलयः फलितानि च रसप्रदोषजाः रोगाः वक्ष्यन्ते रक्तप्रदोषजाः कुष्ठविसर्कपिडका रक्तपित्तमसृग्धरः उदमेढ्रस्य पाकश्चप्लिः गुल्मोऽथ विद्रदिः नीलिका कामलाव्यङ्गः पिप्लवस्तिलकालका ददृश्चर्मदलं शूत्रं पामाकोठास्त्रमण्डलम्. So that is regarding the रक्तप्रदोषज विकार. अधिमांसार्बुदं कीलं गलशालोकुशुण्डिके पूतिमांसालजिगण्ड गण्डमालोपजिह्विका निन्दितानि प्रमेहाण पुररूपाणि यानि च अद्यस्तिदन्तो दन्तास्ति वेदशूलं विवर्णता केशरो मनकश्मश्रु दोषाश्चास्ति प्रदोषजा ऋक्पर्वणां भ्रमोमूर्छ दर्शनं तमसस्तथा अरुषां स्थूलमूलानां पर्वजानां च दर्शनं शुक्रस्य दोषाय क्लैब्यम् अहर्षणं रोगी वा क्लीबमल्पाय विरूपं वा प्रजायते न चास्य जायते गर्भः पतति प्रस्रवत्यपि शुक्रमिदुष्टं सापत्यं सदारं बाधते नरं दुष्टानां तु कल्शाम् इदं विशेषज्ञानं भवति तद्यथा अतिसृष्टमतिबद्धं प्रकुपितमल्पाल्पमभीक्ष्णं वा बहलं सशूलं मुद्रयन्तं दृष्ट्वा मूत्रवाहन्यस्य स्रोतांसि प्रदुष्टानीति विद्या प्रदुष्टानां तु खल्वेषम् इदं विशेषज्ञानं भवति तद्यथा कृच्छ्रेणल्पाल्पं सशब्दशूलम् अतिद्रवम् अतिग्रथितम् अतिबहुच अपवशन्तं दृष्ट्वा पुरुषवाहन्यस्य स्रोतांसि प्रदुष्टानीति विद्या दुष्टानां तु खल्वेषम् इदं विशेषविज्ञानं भवति तद्यथा अस्वेदनम् अतिस्वेदनं पारुष्य अतिशक्षताम् अङ्गस्य परिदाहं लोमहर्षं च दृष्ट्वा स्वेदवाहन्यस्य स्रोतांसि प्रदुष्टानीति विद्या चरकविमान 5th chapter. सामान्य अमलक्षण स्रोतो रोध बलभ्रंश गौरवानिलमूर्ता आलस्यापत्तिनिष्ठो बलसंगारचिक्लमा अष्टांग हृदय सूत्रस्थान chapter number 12. साम and निराम दोष लक्षण वायु साम विबंधाक्ष साध तंद्रांतर पूजनैः वेदना शोफनिस्तोदे क्रमशोंगानि पीडयन् विचरे दिगपच्चापि गृह्णाति कुपितो वृषं स्नेहातेर्वृद्धिमाप्नुत् सूर्यमेघोदये निशि निरामो विशदो वृक्ष निर्विबन्धो अल्पवेदनः विपरीतगुणैश्चान्ति स्निग्धैर्याति विशेषतः दुर्गन्धः मृतं शामं पित्तमलं स्थिरं गुरु अम्लिका कण्ठहृद्दाः करं सामं विनिर्दिशेत् आताम्रभितमत्युष्णमरसे कटुकमस्थिरं पक्वं विगन्धविज्ञेयं रुचिपुक्तिबलप्रदम् आविलस्तन्तुलस्त्यान कण्ठदेशवतिष्ठते सामो बलासो दुर्गन्धः क्षुदुद्गारविघातकृत् पेनवान् पिण्डितः पाण्डुनिस्सारो अगन्ध एव च पक्वा स एव विज्ञेष्ठेदवान् वक्त्रशुद्धिकृत्. मधुकोश माधवनिदान 1st chapter 5th श्लोक. साम निराम पुरुषलक्षण संसृष्टमेभिर्दोषैस्ति नस्तमप्सुवसीदति पुरुषं वृषदुर्गन्धि पिच्छलं चाम संनितम् एतान्येव लिङ्गानि विपरीतानि यस्य वै लाघवं च विशेषेण तस्य पक्वं विनिर्दिशेत्. माधवनिदान chapter number 3. साध्यन् असाध्यवादि लक्षण एतवः पुररूपाणि रूपाणि अल्पानि यस्य च न च तुल्यगुणो दोषो न दोषः प्रकृतिर्भवेत् न च कालगुणस्तुल्यो न देशो दुरुपक्रमः गतिरेकानवत्वं च रोगस्योपद्रवो न च दोषश्च एकः समुत्पत्तो देहः सर्वौषधक्षमः चतुष्पादोपपत्तिश्च सुखसाध्यस्य लक्षणं निमित्तपूर्वरूपाणां मध्यमे बले कालप्रकृतिदूष्याणां सामान्य अन्यतमस्य च गर्भिणी वृद्धबालानां नात्योपद्रवपीडितं शस्त्रक्षाराग्निकृत्यानां अनवं कृच्छ्रदेशजं विद्यादेकपथं रोगं नातिपूर्णचतुष्पदं विपथं नातिकालं वा कृच्छ्रसाध्यं विदोषजं शेषत्वात् आयुष्यव्याप्यम् असाध्यं पथ्यसेवया लब्धाल्पसुखमल्पेन हेतुनाशप्रवर्तकं गम्भीरं बहुधातुस्थं मर्मसन्धिसमाश्रितं नित्यानुशायिनं रोगं दीर्घकालमवस्थं विद्याद्विदोषजं तद्वत् प्रत्याख्येयं त्रिदोषजं क्रियापथम् अतिक्रान्तं सर्वमार्गानुसारिणम् औत्सुक्य रतिसम्मोहकरम् इन्द्रियनाशनं दुर्बलस्य सुसमृद्धं व्याधिं सारिष्टमेव च. This is about the context of Charaka Sutra 10th chapter. These are the things that one has to know in detail along with their meaning. If possible, try to apply it in terms of Western physiology and pathophysiology and in terms of physics, chemistry and biology. We can able to apply these then we can able to learn the concept of Rogamarga even in deeper understanding. When you think about the Bahya Rogamarga, as we have discussed, Rakta, the six dhatu, as well as Tvak will be included in this particular type of Rogamarga. So here, what we can say, there may be a possibility of the neck swelling. There may be a possibility of affliction of Mamsa as well as Medo Dhatu in this particular aspect. Here, it's an image related to the left lower limb. So here we are going to observe the skin eruptions. Here we are going to know that there may be a possibility of affliction of Rakta Dhatu. Here, the person is having the marginal area of what you say that the sclerocorneal junction affliction. So here, there is a possibility of affliction of what you say that the Rakta as such. So here, there may be what we can say the apachi. There may be a possibility of the lymph node affliction. That is, that too of longer duration. Here, we are going to say that there may be a possibility of pedunculated structure. So that means it will be having the peduncles which will be connected with the swelling as well as to the skin. What we can say, the charmatila. Here, adhimamsa, there may be a possibility of hypertrophy of the gums as such. Here, there may be a possibility of rakta as well as mamsa dhatu affliction we can able to observe. So that is the here what we can say, that is the possibility of the mashaka. What we can say, there may be a possibility of the affliction of rakta as such. Kushtha. So there may be a possibility of the Tvak, Rakta, Mamsa and Lasika affliction in this particular occasion. Vyanga, there may be a possibility of what we can say, the discoloration which is observed on the cheeks as such. There may be a possibility of Rakta involvement in this particular occasion. Now, regarding the Madhyama Rogamarga affliction, regarding the different examples. So here, whenever if you say about the Madhyama Rogamarga, there may be a possibility of involvement of the marma or vital parts and asthi, that may be the bones, and sandhi, that may be the joints that may be afflicted, as well as there may be a possibility of the kandara, snayu and kandara, which is connected with the asthi and sandhi, that can be afflicted here. So here the example, there is the pakshavadha. So here there may be a possibility of shiras affliction. What we can say, the present day cerebrovascular accident or stroke that is being mentioned. So here the apatanaka, the person will be having the seizures or involuntary movements which is associated with transient syncope. So that is the what we can say, the apatanaka as such. Ardita, there is the affliction of one half of the face as such. Shosha, so that is extreme emaciation. So here almost all dhatu kshaya may be observed. So in this particular occasion, rasa dhatu affliction, rakta dhatu affliction, mamsa dhatu affliction, medu dhatu affliction can be very well easily identified. Raja Yakshma, wherein extreme emaciation is one of the criteria that can be observed here. Asthishula, there may be a possibility of pricking type of pain in the joints as such or in the bones. That is asthishula. Sandhishula, pricking type of pain observed in the joints. Udapramsha, that is what we can say, the rectal prolapse. That is prolapse of the rectum through the anus that is going to get observed. So these are the Madhyama Rogamarga Vikara plus Shiro Roga, certain the diseases related to head, Shiras, wherein the person may be holding the head with excruciating pain, etc. Hridroga, so that is another marma, what we can say the trimarma as such. Basti Roga, so that is where there may be a possibility of affliction of urinary bladder. So this is another important trimarma. If you are observing there is involvement of these, then we are going to say the person is having the Madhyama Rogamarga affliction. As far as Abhyantara Rogamarga are concerned, there will be the possibility of Mahasrotas affliction. Examples given are Jvara. So wherein initially the Pitta dosha dominance with Rasodhatu affliction can be observed. Initially there will be the person will be having the loss of appetite, or what we can say the Agni-mandya. So from there there will be the movement of these particular pathogens or whatever they are being released in the alimentary canal, that is going to get entry into the Rasadhatu level via what we can say the intravascular compartment. So that is Jvara. Atisara, wherein the person will be having the excessive the passage of liquid stools that is happening via alimentary canal. That to lower the part of the that is the alimentary through the anus itself. Vomiting, so that is upper alimentary canal. So through that the contents of the alimentary canal that are going to get eliminated via mouth. Alasaka, that is bloating sensation of the abdomen, wherein the person is not in a position to feel any kind of the hunger at all. Visuchika, wherein the person will be having the vomiting and diarrhea so much so that all the body, the person will be having the craving for the nutrients. So that is the skeletal muscles, smooth muscles, cardiac muscles, and nerves as such. Nerve impulses, they require all these electrolytes. So because of the extreme depletion of these from the alimentary canal, all these the persons will be having the craving for these nutrients. That is what we can say the Suchika. Kasa, that is either there may be a possibility of dry or productive cough as such. Shwasa, breathlessness, where the Vata and Kapha dominance is being observed. Hikka, wherein the person will be having the hiccup as such. So these are considered to be the Abhyantara Roga Margaja Vikara as such. So now, how to understand this particular Rogamarga as such? Let us know with the small example. So here is a case scenario, imaginary case scenario, wherein we can able to see the 25 days history. So wherein in the first day, the person is doing the Adhyashana. So that is, the person is going to take the large amount of the food frequently within a matter of 2 hours of the food in between the two meals as such. So wherein the person is going to do that continuously for 5 days. So that will be leading to the clinical manifestation in the upper alimentary canal. Maybe initially that will be observed in the mouth, then that can be observed in the pharynx, esophagus, and the stomach. So here the symptoms are observed in the stomach in most of the occasions because the food that will be ingested, that will be stored in the stomach for more than the for up to 2 hours as such. After that, the 10th day, the person is doing the walking for up to 4 kilometers. So, so that means if he is having the sedentary lifestyle and if he is doing this particular amount of the walking, then the lakshanas that may be observed in the hip joint or knee joint or ankle joint or foot or muscles or tendons or ligaments of the lower limb. Further, on 25th day, so the person is going to take consumption of the 2 plates of gobi Manchuria, which is considered to be very, very spicy. In that particular situation, the lakshanas specifically will be observed in the mouth, pharynx, esophagus, and stomach. But when you think about the day 1 and day 25, day 1, the clinical manifestations were much slower, whereas day 25, the clinical manifestation they will be observed in those organs will be much, much rapid because the person is going to consume the very spicy gobi Manchurian. Hence, the clinical manifestation in this particular occasion that we can able to see much, much rapidly. So when you think about this, so we observe the exposure of the Nidana as such in the day 1 and day 25 that is considered to be related to the mouth as such. Whereas on the day 10, the nature of the exposure of Nidana is only related to the lower limb. Maybe the joints of the lower limb, maybe the muscles of the lower limb, or maybe the tendons or ligaments of the lower limb. That's why the lakshanas of the vitiated dosha are specifically seen in those organs only, not in the other organs. This is what is considered with importance of Rogamarga as such that we can able to learn. Why we need to know about the Rogamarga? Suppose if there is a what is it the Nidana as such, what we can say the pathogen in this particular occasion that is only being observed in the stomach itself. In that particular situation, the ideal way of removal of this particular pathogen will be through MSS or medicated MSS or what we can say the Vamana. Suppose if the pathogens are being present even in the small intestine also, in that particular situation, the person needs much more intense line of treatment. Vigorous treatment may be required. In the initially, the person, if the pathogens are present in the stomach, then that has to be eliminated via mouth. If they are present in the small intestine, that has to be eliminated via the anus in the form of virechana. Suppose if the pathogens are present even in the large intestine also, in that particular situation, so much more vigorous treatment is required than the earlier 2 occasions. Suppose if the pathogens are present in this particular way, that is intravascular compartment and interstitial compartment, and as well as in the stomach, in that particular situation, so that is the pathogens should be made to move from interstitial compartment to intravascular compartment. From there, that has to be moved into the stomach. Then that has to be eliminated via mouth in the form of vamana. Then, if the pathogens are present even inside the cell, then that has to be brought into the interstitial compartment. That has to be brought into the intravascular compartment. That has to be brought into the stomach. Then that has to be get eliminated via mouth in the form of vamana as such. So in this way, suppose if the pathogens are present, which may be considered to be of pitta dominance, then that has to be present if it is inside the cell, that has to be brought into the small intestine, then that has to be eliminated via virechana as such. That's how when the pathogens are only restricted into the stomach or alimentary canal, that is comparatively easier to cure. Whereas if the pathogens are present in the intravascular compartment as well as in the alimentary canal, that requires much more intense line of treatment. So that means more treatment may be necessary. So that means if the person is not getting the adequate line of treatment, that may be comparatively difficult to cure. If the pathogens are present in the interstitial compartment, then as well as intravascular compartment, as well as in the alimentary canal, that is even much more difficult to treat. If the pathogens are present even inside the cell, what we can say intracellular compartment, then in that particular situation, if they are present in all the four compartments, then that is considered to be even much more difficult to treat. So this is what we can say the significance of Rogamarga as such. When you think about this, what are the points that should be known while the assessment of Rogamarga? So that is, first of all, we need to know about any symptoms related to Bahyasrotas. We know 9 Bahyasrotas are present in the males and Bahyasrotas are present in the females. First of all, we need to know about if there is any kind of the symptoms are persisting related to any of the Bahyasrotas. Suppose whether the lakshanas are being observed in the mouth or in the nose or in the eyes or in the ears or in the urethra or in the anus or in the vagina or in the breast as such. Is there any symptoms are being observed? That has to be known. Then any symptoms related to abhyantara srotas that are there or not, that should be known. As we have discussed in the earlier, we need to know about very kind of the pranavasrota subflexion or rasavasrota subflexion or raktavasrota subflexion or purishavasrota subflexion, that has to be known. Then we need to know about duration of the presenting complaint. What is the duration of the presenting complaint? Suppose if the person is having any kind of the discomfort, first of all you need to know about how many time duration the person is having that particular discomfort as such. Based on that, we have to analyze, is there any dosha affliction or dhatu or mala affliction that can be observed, that has to be known. Then we need to know about the affliction of the different srotas or injury to the different srotas has to be known. Then we need to know about the any kind of the ama lakshana that are being observed in the that the body has to be known. Then based on that, we have to come retrospectively, so that we need to know about what are the possible dosha prakopa karanas as well as srotodushti karanas has to be analyzed. All these will be helpful in analyzing the entry of the pathogen into the human body. And after that, so you should know about the presenting complaint along with the duration plus chronology of the symptom, that is the presenting complaint has to be known. Then severity of the presenting complaint should be known. Then course of the presenting complaint should be known. When you think about the further application as such, suppose the source of the entry of the pathogen. Suppose if the pathogen is entering through the mouth, then that has to be moved from the mouth to esophagus. From there it will be moving into the stomach, then it is moving into the small intestine, then it is moving into the large intestine. So that means this may be the probable entry of the pathogens that is going to take place if that is happening through the mouth itself. Suppose if the person is doing the more and more amount of the work in relation to the movement of the left wrist as such. So that means the symptoms that may be related to this particular left wrist joint, that will be more common. In this way, you can able to know about the source of entry of the pathogen. We can able to plan, we can able to decide depending upon the nature of the entry the person will be having the presenting complaint. So after that, you need to know about the presenting complaints, that is chronology has to be known. Suppose if the person is having the adhyashana as such, the clinical manifestation that may start observed in the mouth first, then you are going to observe in the esophagus, then we can observe the affliction of the stomach, then small intestine, then large intestine can be observed. In this way, the chronology with the presenting complaint can be known. Suppose if the person is having the severe presenting complaint, the person is not having any kind of the reduction in the presenting complaint as such, then that indicates the person is having the entry of the pathogen is continuing. Suppose if the person is having the initially severe presenting complaint, now it is getting milder. So that means there may be a possibility of the less number of pathogens are entering into the human body, or that may indicate the person is having the, what do you say, that the uh, uh, response of the treatment that can be predicted. So that is what we can see, the course of the presenting complaint can be deciding. The take-home messages from today's discussion are: Rogamarga is considered to be one of the very important concept of Ayurveda diagnostics, what we can say the Roga Nidana as such, where we can able to know about the nature of the pathogen and movement of the pathogens that can be determined. So that can be determined by source of the entry of the pathogen that is taking place either in the Bahya Srotas or Abhyantara Srotas. And number of the pathogens entering into the human body. So less number of pathogens, the person may be having the milder form of the disease. More number of the pathogens, that indicates more severe form of the disease as such. And the third one, that is virulence of the pathogens entering into the human body. So that is less virulent number of pathogens, the person will be having the milder form of the disease. More virulent pathogens, that if they are entering into the less in number, then also the person may have severe form of the disease as such. Three types of the Rogamarga are being explained in Ayurveda. So that is Shakha, or otherwise that is also being termed as Bahya Rogamarga, or Marmasti Sandhi as such, that is also being termed as Madhyama Rogamarga, and Koshtha, which is also being termed as Abhyantara Rogamarga. As far as its knowledge significance is concerned, it helps in the determining the prognosis of the disease, or what we can say the sadhya sadhyata of the disease. That's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below, and spread this particular video to maximum number of true Nidana learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.